Welcome to this video on amyotrophic lateral sclerosis, also known as ALS, motor neuron disease, or progressive muscular atrophy. Amyotrophic lateral sclerosis is a neurodegenerative disease that accompanies the death of central and peripheral motor neurons. The main manifestations of the disease are skeletal muscle atrophy, fasciculation, spasticity, hyperreflexia, pathological pyramidal signs in the absence of pelvic and ocular motor disorders. It is characterized by a steady progressive course, leading to death. Amyotrophic lateral sclerosis is diagnosed on the basis of neurological status data, ENG, IMG, MRI of the spine and brain, cerebrospinal fluid analysis and genetic studies. Unfortunately, to date, medicine does not have effective pathogenetic therapy for ALS. Causes of ALS. Amyotrophic lateral sclerosis is the final pathway of a cascade of general pathological reactions initiated by various known or unknown triggers. In some cases, amyotrophic lateral sclerosis may be caused by mutations in the superoxidimutase 1 gene, when the main pathogenetic factor is the cytotoxic action of the defective enzyme. Mutant superoxide dismutase 1 accumulates between the layers of the mitochondrial membrane, disrupting axonal transport, interacts with other proteins, which leads to a violation of their degradation. Diagnostic supervision of patients suffering from amyotrophic lateral sclerosis is carried out by neurologists. In some patients, it is possible to identify a positive family history, a close relative with this disease. When examining the patient, there is a decrease in muscle tone, bulbar disorders, the presence of crampy, painful muscle contractions. To clarify the diagnosis, an additional examination is prescribed, including IMG. When performing needle electromyography, there is a decrease in the pulse rate, an increase in the amplitude and duration of the action potential of motor units, episodes of electrical activity. Muscle biopsy. The histological picture of the nerve biopsy shows signs of demyelination, swelling, decay and death of axial cylinders. MRI. MRI of the brain is performed in order to exclude other neurodegenerative diseases that have a similar clinical picture. In rare cases, patients with ALS have an amplification of the signal from the corticospinal tracts. DNA analysis. By the polymerase chain reaction method in some patients, it is possible to identify mutations in the genes superoxide dismutase 1, SOD1, and C9orf72. In cases of familial form of amyotrophic lateral sclerosis, mutations of the FUS, TARD genes are found. Treatment of ALS non-drug therapy. All patients with this diagnosis should be hospitalized in the neurological department. There is no effective treatment that can stop the progression of the disease. The only drug that affects the pathogenesis of amyotrophic lateral sclerosis is riluzole. This drug inhibits the release of glutamate from neurons, an amino acid that triggers the process of degeneration of nerve cells. Its use can prolong the life of the patient by an average of 3 months. All therapeutic measures are aimed at stopping or alleviating the main symptoms of ALS, bulbar disorders and spasticity. Physical therapy. To maintain muscle tone, regular physical activity is recommended. In the initial stages of the disease, active exercises are performed. In the later stages, when independent movements are difficult, passive. Orthopedic devices. to fix various parts of the body in order to prevent bone deformities and articular contractures. Orthoses, corsets, immobilizing splints are used. Nutrition. With the development of bulbar disorders due to weakening of the muscles of the pharynx and tongue, there is a danger of food entering the respiratory tract. Therefore, it is recommended to eat semi-solid foods, cereals, purees. Food intake should be performed in an upright position. In severe dysphagia, endoscopic gastrostomy is performed. Maintenance of respiratory function. A very important aspect in the treatment of patients with amyotrophic lateral sclerosis. Depending on the severity of oxygen deficiency, oxygen inhalations through a nasal cannula or face mask, non-invasive ventilation of the lungs through portable ventilators are prescribed. Ensuring communication. In severe patients with severe muscular atrophy and dysarthria, various electronic or mechanical communication devices are used to facilitate communication with others. Drug therapy. All of the above measures will have the maximum therapeutic effect only in the case of their joint and regular use, as well as supplementation with pharmacotherapy. For the treatment of patients with ALS, the following drugs are prescribed: muscle relaxants and anticonvulsants. To combat muscle spasticity and painful cramps, drugs that relax the muscles, baclofen, tolperazone, and anticonvulsants, carbamazepine, phenytoin, are effective. Anticholinergic blockers. With severe salivation, medications that suppress the production of saliva are used. Blockers of M-cholinergic receptors, atropine, hyoscine, dextromethorphan and quinidine. These drugs have proven themselves for the correction of bulbar disorders. Mucolytics and expectorants. In patients with weakness of the respiratory muscles, to eliminate such problems as an accumulation of thick sputum in the respiratory tract, drugs that dilute sputum, acetylcysteine. Prophylaxis. Methods of specific prevention of amyotrophic lateral sclerosis do not exist. The only effective way to prevent the development of the disease is prenatal diagnosis, detection of mutations in the amniotic fluid or chorionic villi, and termination of pregnancy. Secondary prevention is to prevent complications. In summary, ALS is a complex and devastating disease that affects the nervous system and leads to muscle weakness, wasting, and paralysis. While there is no cure for ALS, there are several ways to manage the symptoms and improve the quality of life for people with ALS. If you or someone you know is experiencing symptoms of ALS, please seek medical attention and support from ALS associations and advocacy groups. Thank you for watching, and please subscribe to our channel for more health-related videos.